I thought we were already live. I've been talking to myself. Tish is laughing at me. Dr. Petro is finally done seeing patients for the day, and I've had a lot of fun kind of going through your questions, and I'm going to give them to her now. Are you ready to do questions?
Sure.
Okay. So being live is totally weird.
Not my thing.
Not my thing, no filter. All right, so she's done seeing
Need
patients.
some flowers on my head right now.
Yeah, I need a flower crown and some, yeah. Overwhelming response was about the neck. So I'm going to kind of give Dr. Petro some of the questions that you guys answered, and this is going to be fun. Are you ready?
Sure.
Okay. All right, so Sarah J emailed us, and she asked, what are some treatments, non-invasive, that we can do for just the weird lines that she has on her neck? She says she's not even 30 years old yet, but she, like me, I guess, has the tech neck.
Chloe does have a tech neck. If y'all are not familiar with that, that's from all this. But the horizontal lines across the neck, we can use skin tight on those. We can also use some laser treatments to make the skin look smoother. And it does make a big difference because really your face stops, Chloe.
Your skin, your face ends at your nipples.
And that really is true. And you see people that come in, we say it a lot around here, but where you've kind of almost forgotten about your chest or your neck, and then you see it. And I've heard some of you say in other times that just your neck is like, what was the word? It takes on a life of its own, and it really does. And a lot of times that's the first time you see aging, and nobody likes an old neck. But there is a lot we can do with the texture. There are even some creams. Nectifirm works great if anybody's ever used it. And it helps keep things the way you want them. And it also tightens your neck. We use it all over. I've been putting it on the tops of my knees.
I use Nectifirm morning and night every single day. Swear by it. I cried over it when TCA or TSA threw it away at the airport, so that's how you know it's really good. All right. This question, because we've had a lot of questions about cool sculpting, so I think it's really important to kind of talk to people about the pros and cons between cool sculpting and liposuction, as a lot of people, you know, they're interested in that tiny little area underneath the chin, underneath the neck. What would you say about that?
Well, I think it depends on the patient. If you have a lot of loose skin and some extra fat, then you would do liposuction, and typically that requires at least a mini facelift to get the skin from the neck back up. If you just have some fat and you're younger, Tish, come here. Like, I guess she already left. But she has some extra fat under her neck, and
honestly doesn't need
another thing. And cool sculpting won't loosen the skin, so it just kind of pulls it away. It takes about 35 minutes, and it freezes the fat, and then you're left with a much better chin. People do the craziest things for their double chins, and it casts a shadow that's a little bit lower. So we've had people say that people come up and try to wipe away the dark area of their neck, and it's really the shadow from the fat. I've had people say it reminds them of a parent that either they liked or didn't like. Either way, they don't necessarily want to have that on their neck. It usually just takes one treatment, so it works really well.
We love cool sculpting. We've been doing a ton of it. Still on the subject of the neck, as far as a lot of people kind of mentioned this one word a lot of y'all have in common, the crepiness. Can you tell us how you think skin tight, probably our most popular issue this summer, how does skin tight treat those lines, the crepey skin on the neck or the face?
Skin tight uses heat, and it uses the heat to heat up the collagen, which forms and makes you make new things that make the skin tighter, like elastin and tighten. They're all types of little genes that can become expressed when you're using skin tight that help you look younger and feel younger. It also just feels good. I mean, it feels really tight. It helps smooth the skin, so it helps smooth that texture out, and it tightens it a little bit too. There's an immediate effect. I use it on my brows. I love it. It's my mother's favorite treatment because she's not under the knife, and there's no downtime, and it doesn't hurt. So it's a great treatment.
I think that's probably I went through, I hate how it's so delayed. I went through the questions from the patients, and a lot of you guys ask just a lot about the cool sculpting. I know we're trying to focus on the neck, but just remember there's no downtime with the cool sculpting, and no one's going to be able to tell that you had anything done. A lot of people ask about non-invasive treatments, and I would say your options there are pretty much endless. We've got lasers, we've got injectables, we've got products. Tell us a little bit more about, let's see here. Another really, really good question was, people have been asking about, like, I know we were talking about product for the neck, but for the face, how do you think that skin tight treats. They want to know how it works for the brow lift. That was what one patient asked.
Oh, well, actually, I do it a little bit differently for the brows, and I learned it doing it on myself because people used to think a brow, first, there's no surgery done that looks worse than a bad brow lift or brows that are too high. Almost everybody comes in and says, I want this, I want my brows lifted, but I don't want to look like, and they'll name somebody. But I mean, when your brows get up to here, it just looks really odd. Mm-hmm. So the goal is to raise them, usually the lateral corner, just a little bit of lift there helps a lot. And that's what the laser does. It also makes your forehead feel tight. So with Skin Tight here, you can get several millimeters of lift on your brow. It's temporary until you've had probably 4 treatments, and then it stays. What's not temporary is every time you have it, your skin is smoother. I mean, I have acne patients with scarring that come in to get Skin Tight, and they've had, you know.
She did it on my forehead for the expression lines that I inherited from my father that I guess are there for good, but she treated them on my expression lines and they really softened them. So just a lot of people need to learn about Skin Tight. If you get it Botox for lifting your brows, Skin Tight is definitely another option.
Or both.
As well.
I mean, some of us want both because nobody wants a brow lift anymore. I mean, just because, unless you absolutely have to have it, because we're all attuned to seeing celebrities and people that just walk in like this. And most people have a family member that comes back from having a facelift and looks a little surprised or scary. So that's the last thing anybody wants. Somebody was asking me today, she's like, you know, it really works. I wasn't sure at first, but it really works. And she's just really happy with it. And I said, yeah, it is nice when somebody will tell you the truth. I mean, when we first got it, I didn't use it, and because we'd gotten it to get BBL, and it's on another laser. But I was afraid to use it because we've tried Exelis, we've tried a lot of things that really didn't have great results that people weren't happy with, and so we don't want to do them. And so the Skin Tight was very different because when you first did it, you noticed that it works. And so it's one of those things where if you're in a dressing room and you're trying on clothes, you ask somebody, does this look good? And they're going to look at you and you're thinking to yourself, you know, I'm going to know later and I won't come back. If, you know, I don't want to wait till I see my sister to know that my new outfit looks bad.
Right.
And that's how we do things. I mean, we treat everybody like family and want everybody to know what really will work and what won't. And that's my goal.
Okay, cool. Well, we're going to wrap it up for today. Thank you for submitting all your questions. We seriously enjoy all of your feedback, and we have a lot of fun going through them. I know doggy daycare is almost over, so Dr. Petro's got to go. But if you just leave us some more questions, we love doing the Q&A. We're going to be doing a lot more, and if you comment below, we can get back, and we're going to do more later this week. How do I go offline?
Chloe's used to hitting end and changing the filter.
How do you go off? Finish. Bye, y'all.